The next thing is our furniture is killing us, and I want you to think about, where do you spend most of your time? Are you on the chair or the sofa looking at the tube? And that tube might be the TV, it might be a computer screen. More commonly, it's your telephone screen. And what we now know is that sitting is truly a disease. Sitting changes all sorts of chemical pathways, especially the insulin resistance pathways, and changes them for the worse. So think about where you're spending your time. And you might be one of those that says, but Dr. Wright, exercise, that just is that's a dirty word. And here's what a lot of people think about when it comes to exercise, that they really have to be running, that they have to be to the point of sweating and near exhaustion, that they've got to be pumping iron. Well, all of those are certainly choices, but it turns out that all movement is medicine. It does not have to be a high intensity activity to give you benefit. So for an example, some of the senior citizens that might be watching this, chair fit classes are an excellent way to get not just flexibility exercises, but to increase your heart rate and to increase your blood pressure. And they'll do some gravity-based exercises that will actually improve your cardiovascular fitness. The water is a wonderful place to get activity for lots of reasons. My wife is a water aerobics instructor, and it taught me quite a bit about the benefits of water aerobics. It takes the pressure off your joints. It actually redistributes fluid into your cardiovascular system to make your heart pump more efficiently, which can be very important for those of you who may have some element of heart dysfunction, some weakness of the heart muscle. People with chronic obstructive pulmonary disease, just sitting in the water on the steps and breathing against the resistance of the pressure of the water around your chest can improve lung function and the strength of those lung muscles, the chest cage muscles. So think about the possibility of water-based exercise. And although we call it ballroom dancing, it really ought to be ballroom exercise. You can take lessons, and because you're upright and you're having to do balance things and you're having to think and engage your brain, and at the same time make your heart work harder and your muscles work harder, the benefits of that as an exercise are phenomenal. So think outside the box on exercise. And in fact, I don't like to use the word exercise. I like to use the word movement. What can I do to move more each day? And to that end, one of my sons has his degree in exercise science, and he actually helped to develop this concept for my patients that he called the 3 in 60 movement program. And all that means is that for every hour that you are seated, and if you're in a desk job most of the day, or if you're at home most of the day and you're on your couch or sofa or whatever seated position, for every 60 minutes you're doing that, let's get up and move for 3 minutes out of that hour. And it can be as simple as standing there. So think about 3 minutes of movement for every hour. And that really does help to undo the effects of that chair. Now, yes, we need more than that. And Ford has many excellent exercise videos out. But let's start somewhere. Where are you willing to start? What are you willing to do differently with your fork and with your furniture to help improve your heart health? And so really just a couple of take-home points. Let's enjoy colorful foods. Let's eat that rainbow. And let's move every single hour, at least 3 minutes, and get the benefit of both our food and our activity level. Because Abraham Lincoln was right. In the end, it's not the years in your life that count. It's the life in your years And I know that's why most of you came to this channel. You want to add life to those years. And so don't overlook some of the simple decisions that you make each and every day.
So we've had a lot of people ask about how to get into the CIMT event. We've got a whole schedule on the membership page. I'm going to take you through that real quick. First of all, you go to prevmedheartrisk.com. That takes you to our website. Click on the membership login page, and membership is free. You just have to give your email address. Then you'll see you've got a menu over on the left, live webinars, second live webinar, CIMT events. Click that button, then click the gray button, and you see all of the schedule for getting a good, reliable CIMT near your area. Orlando, Central Western Ohio, just west of Cincinnati, Austin, Texas, Detroit, Michigan, Rochester, Memphis, lots of places, and most of these are thanks to our good friend David Mites. And again, CIMT done reliably has got a lot of advantages. Very good way to screen, much better than stress tests, and a lot more comfortable than going to the cath lab. Thank you for your interest, and go get a good CIMT near you.